I would like to thank MGTOW 5513 for sending me this story that is coming out of the state that I live in which, yet again, Larry the Hog Hogan is a topic of discussion. And he's actually talking about something that I have not spoken about on my channel for quite some time. And that is none other than that opioid plague. Yes, this is going to be one of those I feel nothing type of videos. So basically, in this article from the Baltimore Sun, Larry Hogan made a vow that he would take care of the opioid plague and get the numbers of overdoses and deaths and dealers off the street, down to a minimum. But ever since he made that said vow, everything went in the complete opposite direction. Instead of it going way down, it just ended up going up, and away. And for that, Larry, I say thank you for giving empty promises. It's amazing to me how you have a lot of these white politicians who say they're going to do this, that, and the third for this opioid plague and try to get the numbers down and everything like that, but they end up not doing anything, or they realize they are in over their heads. This is something that has skyrocketed out of control. There's nothing that they can really do about it. If this plague is to end, which I hope doesn't end anytime soon, because let's face it, myself and Lisa enjoy making these type of videos. Like, what can you do? It's not going anywhere. It has to end on its own. Much like how the crack epidemic that plagued black people back in the 80s and 90s affected us, but it slowly started to taper off. That was our time. Now it's their time. Let me go ahead and read this article. It says, when Larry Hogan ran for governor 4 years ago, he vowed to urgently address what he called Maryland's heroin epidemic. Now, this is 4 years ago. This is back in 2014. White people became the face of heroin in 2016. I didn't even know Maryland had a heroin problem until more so recently. That's how much they really kept that one, under wraps. It's a major disaster, the Republican, or should I say the Rethuglican, said during an October 2014 speech. In January, I will immediately declare a state of emergency. See, that lets you know he's dropping the ball already. He's waiting until fucking January to declare it a state of emergency, even though he should have declared it a state of emergency back in 2014. So he's about to be going on 5 years being too late. But that's fine by me. At the time, Maryland was approaching 888 opioid overdoses deaths for the year. For those of you who play the lottery, you should go and play that number, 888. And then record pace that Hogan was blaming on ineffective efforts by his Democratic predecessor, Governor Martin O'Malley. But upon taking office in January 2015, Hogan did not immediately declare a formal emergency. See, that's his fault. Instead, he set up a statewide task force that worked for a year to deliver 33 recommendations. As administration's officials rolled out the strategies during 2016, opioid fatalities mounted to 1,856 people that year, a death count that ranked Maryland fourth among the 50 states for per capita drug fatalities, in which I'm certain Ohio was still number one in the hub. It said 2016. That's right around the time when I started talking about these opioids. In all, 5,533 Marylanders died of an opioid-related overdose from the start of Hogan's term through March 2018, a period of 3 years and 3 months. That's more than 5,019 who died during O'Malley's 8 years in office. God damn. So that's why he wants to declare a state of emergency. And see, the midterm elections are coming up, and he knows he has to secure these seats. So now he's giving these empty promises, and he's only catering. Let's be honest here. This is only being catered to mostly the white constituents, because when we see all these opioid related deaths, we rarely, if ever, see any black faces of those who are actually dying from an opioid overdose. Let's put it this way. If I had to hypothetically say, for every probably, let me just say it, throw a shot in the dark. For every maybe 6,000 overdoses, there might be one black person in the bunch. Every 6,000. And that's not just talking about in a particular state. I'm talking about nationwide. Let's continue. It's been very frustrating, Hogan said this month. I don't have a magic solution. We've tried everything. I'm surprised he didn't mention anything about Narcan. I noticed that when I've done videos about these opioids and when it came to the state of Maryland, they never really ever mentioned Narcan like that. And would you believe that on one of my videos on my, I think it was original channel, I had did a video talking about Rite Aid wanting to administer Narcan. Would you believe that that video actually got flagged as inappropriate and got taken down? I'm like, wow. That was crazy. I could not believe that they actually, that someone flagged that video as inappropriate and took it down. And I ended up getting a strike because of that. But I think that was on my old channel. The task force recommendations call for such things as expanding treatment and curbing prescription abuse, but was criticized for lacking specifics on costs. The governor, current point man on the opioid crisis, Clay Stamp, acknowledges that the state's initial strategy faltered as a surge in the use of deadly fentanyl more than stripped away some progress achieved in reducing fatalities from prescription opioids and heroin. The task force came up with 33 recommendations. They implemented virtually all 33. And the 33 didn't seem to work. Hogan has continued to make fighting the problem a priority. In March 2017, the governor announced that the state of emergency committing to spend $10 million more per year over 5 years to expand prevention, treatment, and law enforcement efforts. He also appointed Stamp, the former Maryland Emergency Management Director, to head a new opioid operational command center. It is designed to cut red tape as state and local agencies work together to tackle the problem. The additional money, which started flowing in the fiscal year that ended June 30th, has not impressed some experts. That's a drop in the bucket, said Caleb Alexander, a professor at the Johns Hopkins Bloomberg School in Public Health. This is an epidemic that at a national level will take hundreds of billions of dollars over a decade or two. And see, that's the part right there that they don't want to mess with. That's why he waited so long, because he was probably hoping that they could tackle this without having to dip into the state funds, which at this point they're going to have to do. And unfortunately, us as taxpayers are going to be the one that's going to be footing that huge ass bill. Advocates applaud several steps Hogan has taken, especially getting the federal government to let the Medicaid insurance program cover certain residential treatment. They've also praised state efforts to get hospital emergency rooms to screen for substance abuse and distribute the treatment drug buprenorphine. I don't know if I pronounced that correctly. But Alexander and others says Maryland needs to look to states such as Rhode Island, which has managed to reduce its overdose death rates in part by allowing medication-assisted treatment in state prisons. Look at all of that privilege right there. So if they the drug addicts are in jail, they can give them all kinds of treatment to curb their enthusiasm. How about that? I don't think anyone is happy with the slow pace of progress in Maryland, Alexander said. They must have not have seen any of my videos. I couldn't be happier. When you have more people dying from overdoses than from motor vehicle accidents or homicides, or at the peak of the AIDS crisis, we have a serious problem. No, y'all have a serious problem. We good over here. Stamp made no excuses for failing to reverse the measurements that matters most, overdose deaths. No doubt, ultimately, the most important measurement is fatalities, he said. So what to do in a state where, according to a health department analysis, about 62,000 people over age 12 are in need of treatment for opioid use. Damn, over the age of 12. Sheesh, that means starting at age 13, they getting it in. But I noticed too, I don't see anything ever really on the news that actually reflects this. Not saying that this is inaccurate, but they might only talk about it on a local level. But if I have any subscribers out there who are from Baltimore, can you let me know in the comment section, are they talking about this on your local news up there? Because they're not talking about it down here where I'm at. We know that we have to expand our capacity for treatment and recovery. The governor proposed cuts to drug treatment before later putting additional money in the state budget. Critics question how it's being spent. Maryland spent about $135 million on drug abuse treatment during O'Malley's final year in office, state officials say. In his first year of office, Hogan proposed trimming that, but General Assembly leaders managed to get spending increased to $146 million. Logan went on to increase funding to $171 million in the current fiscal year. To date, the Hogan administration's main drug of choice for addressing the crisis has been naloxone, the overdose reversing drug known as Narcan. Funding to get life-saving drug into the hands of the police, fire, and emergency medical personnel has increased from $856,000 in fiscal year 2016 to $3.6 million in fiscal year 2018, which ended June 30th. The number of naloxone doses dispensed increased from nearly 29,000 to nearly 43,000. Stamp said, while all fatalities are tragic, we also have to remember that in the last 2 years, upwards of 20,000 have been saved by EMS administering naloxone. When you talk about what treatment works, that works. People come back and say you're wasting your money. Human life is not a waste of money, Stamp said. You don't get a second chance unless you save the life the first time. Experts say naloxone is important but does not treat addiction. What's needed, they say, are residential and outpatient recovery programs and medications such as that buprenorphine, methadone, and naltrexone. I'm guessing that's how you pronounce it. They put their money into Narcan instead of treatment, said Mike Gimble, an addiction treatment specialist who for many years served as Baltimore's drug czar. Narcan's quote-unquote wonderful, Gimble said, but if you don't get addicts into treatment, they will use again and they will die, and that's what happened. The numbers keep getting worse. We don't have much more treatment than we did before, Gimble added, maybe a little, but not much. Increases in treatment opportunities stem in part from the state's successful push to get the federal government to provide new funding through the Medicaid program to cover residential drug treatment at small community facilities at a private institution such as Shepherd, Pratt, and Towson. Congress last month approved a sweeping opioid fighting bill that incorporates that same measure across the nation, and one that Hogan testified about in March to tighten mail shipments of fentanyl. State officials say there are 3,354 licensed substance use or disorder treatment beds in Maryland. That's an increase from 1,484 beds recorded as available in January 2017. But local health officials say they only see a small increase in the numbers of treatment beds, which they attribute to the Medicaid funding creating demand for organizations to create them. There's much more. It's actually much more to this article, but it's a very long article, and I'm going to just stop right there. Y'all pretty much get the gist of it, but if y'all want to read the rest of it, I'll leave the link down in the description. But yeah, they said all that for me to say this. I feel absolutely nothing, because all of this stuff that they are coming in, all these anti-drugs, these treatment beds, these facilities and all of that, where was all of this when black people were going through this shit 20, 30 plus years ago? Nowhere to be found. That is why I echo the whole I feel nothing stance. There's other reasons, but this right here is the foundation as to why. I repeat that on a constant basis. It's not that I'm cold-hearted. It's just that I'm just leveling the playing field, because guess what? Guess the fuck what? I'm almost certain that when black people were going through that shit back in the 80s and early 90s, and hell, probably even still to this day, that's exactly what they were saying then. I feel nothing. Pull yourselves up by your bootstraps. Just say no. The only difference is we got hauled off to jail, and we had to withdraw within a prison cell. Them, on the other hand, they get safe injection sites. They get Narcan distribution. They get to go to rehab, only to get out and probably do it again. And if they don't die, they get to repeat the process, wash, rinse, repeat, multiple times over. So there's privilege within this plague. Privileges that black people did not get when they were going through their quote-unquote plague. So good luck with that, Governor Hogan, Larry the Hog Hogan. And I guess I can say maybe good luck on your next upcoming election. Because if what I'm reading is indeed true, and from the sounds of it, it is very legit, you're going to be in for one hell of a fight. Because if these people keep dropping like this, they're going to remove your fat ass. Well, it'll probably be hard to remove without a forklift or a crane. But they're going to have to move you out of there and get someone in that they think can actually do something. I mean, let's put it like this. Not that he'd give a damn, but if 45 can't do nothing on a nationwide scale with this damn plague, what makes you think you're going to do something on a local level, on a state level? I mean, it said that your drug abuse and opioids and addictions and overdoses increased way past the times limit that Governor Martin O'Malley's was a few years ago. Yours is just as bad, if not worse than his was under his administration. And it's only going to get more worse. So far, it seems like Rhode Island is the only state that has a success story as far as getting their plague down to a controllable level. But that don't mean a damn thing when you take into account of all the other places that still has numbers that are going through the roof. And I say again, I still feel nothing. Y'all let me know what you think about this down in the comments. Like, share, subscribe. The links will be in the description. I'll talk to you in the next one.